This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, September 9th, and I'm Zach Caruso. Our lead story this week is from JAMA Network Open and is titled Evaluation of a Novel Patient-Centered Methadone Restart Protocol. Restarting methadone for patients who have had a gap in treatment is often a frustratingly slow process for both the patient and provider. This cohort study of individuals examined outcomes for patients of a public safety net opioid treatment program before and after implementation of a 2022 clinical protocol focused on individualized methadone restart doses based on opioid tolerance. Pre-implementation restart doses were 32% lower than the last prior methadone dose, whereas post-implementation restart doses were only 3.4% lower than the last prior methadone dose. There was no significant change in patient safety or 90-day retention and care. Next is an article in The Lancet Public Health titled Targeting Alcohol Use in High-Risk Population Groups, a U.S. microsimulation study of beverage-specific pricing policies. Using a microsimulation model, this study aimed to simulate the effect of beverage-specific price increases on alcohol use within subgroups of the adult U.S. population defined by sex, educational attainment, and alcohol use category. 4 national policy scenarios were compared with a reference scenario without price change in 2019. A uniform price increase of 10%, a uniform price increase of 30%, a beverage-specific price increase of 30% for beer and spirits and 10% for wine, and a beverage-specific price increase of 50% for beer and spirits and 10% for wine. Scenario 4 had the strongest effect on alcohol use overall and most effectively reduced consumption in high-risk groups. Next is a study in pediatrics titled Recognition and Management of Iatrogenically Induced Opioid Dependence and Withdrawal in Children, Clinical Report. This clinical report from the American Academy of Pediatrics summarizes existing literature and provides information on how to screen for symptoms of iatrogenic opioid withdrawal, as well as mechanisms for opioid withdrawal prevention in children. Opioid use is prevalent in both pediatric inpatient and outpatient settings. Abrupt discontinuation of opioids can lead to drug-specific withdrawal symptoms. For patients receiving prolonged opioid therapy, it's best to develop a plan to taper the opioid therapy while minimizing withdrawal symptoms. The plan should include a patient support structure, e.g., family member, prescribing physician, family care pediatrician, and other care team members such as physical and emotional therapists. Use of an opioid tapering strategy should be employed alongside a validated score for assessing withdrawal symptoms. Non-opioid adjuncts should be used for analgesia when possible to minimize opioid exposure. Our next article is in Health and Justice and is titled Using Narrative and Informational Messages to Improve Correctional Professionals' Attitude Toward Medications for Opioid Use Disorder. Access to MOUD remains a critical issue in the criminal legal system, or CLS. This study examined the effectiveness of informational and narrative messages to address misinformation and improve attitudes towards MOUD among CLS professionals. 502 individuals were enrolled across the U.S. and received one of 4 message conditions: no message control, informational message, first-person narrative message, or dialogue message. Both narrative messages and informational messages produced an improvement in attitudes towards MOUD, with slightly more improvement from narrative messages. Dialogue messages also increased support for MOUD in the CLS. However, none of the messages significantly decreased negative attitudes towards MOUD, suggesting that additional educational strategies are needed. Next is a study in the Journal of Substance Use and Addiction Treatment titled Association of Past Year Mental and Physical Health Conditions with Intentional or Unintentional Drug Overdoses. Researchers utilized electronic health records to compare patients with intentional and unintentional overdose and assess for associated psychological and physical health conditions. The researchers found that intentional overdose was associated with past year alcohol use disorder, suicidal thoughts and behaviors, psychiatric disorders, and involvement of multiple substances in overdose. In addition, patients with intentional overdoses tended to be younger and less likely to have chronic medical conditions. The researchers note these findings could help enlighten evaluation of patients presenting with non-fatal overdoses and identify those with intentional overdose and thus higher risk of suicide. Our next article is in Women's Health and is titled Factors that Facilitate Treatment Uptake for Women with Alcohol Use Disorders in High-Income Countries, a Systematic Review. Women suffer negative consequences of AUD but are less likely to seek treatment compared to men. Researchers conducted a systematic review, including 25 publications, to assess factors associated with women seeking AUD treatment. Authors identified factors at the individual, societal, and organizational levels that influenced uptake of care. Factors hampering initiation of AUD treatment include low perception of need, internalized shame, co-occurring mental health issues, and financial barriers. The authors also note that women are more likely to seek care in primary care settings than men, and it's important for these settings to identify patients with AUD and have knowledge of treatment options. Finally, the authors support women-focused treatment as a way to reduce barriers. Next is an article in Drug and Alcohol Dependence titled Imaging Cerebral Circulation in Long-Term Anabolic Androgenic Steroid Users and Non-Using Weightlifters. There have been case reports of cerebrovascular incidents in young users of anabolic androgenic steroids, or AAS. This study used arterial spin labeling, or ASL, MRI to measure cerebral blood flow at the capillary level in 41 weightlifting AAS users and 45 control weightlifters not using AAS. There were no statistically significant differences between the groups in overall cerebral blood flow in gray matter and white matter. However, arterial transit time from the neck to the gray matter shows greater variability in AAS users compared to controls. This variability reflects the efficiency of blood flow to the gray matter and may indicate early vascular dysfunction. The degree of this variability correlated with the total years of AAS use. Authors conclude that these findings in AAS users may indicate risk for cerebrovascular. Our final article is in the Journal of Affective Disorders and is titled Updated Insights on Memory Disorder-Associated Risk of Medication, a Real-World Pharmacovigilance Analysis. This study used the FDA Adverse Event Reporting System to identify medications with reports of memory impairment, amnesia, and dementia. The researchers only used reports where the medication was the primary suspect and calculated the reporting odds ratio to assure the significance of the associations. Many of the medications listed are of interest to addiction medicine practitioners. Gabapentin, pregabalin, and topiramate are associated with memory impairment and amnesia, and pregabalin is associated with dementia. Varenicline and oxycodone are associated with amnesia. Paroxetine is associated with memory impairment, and 8 antidepressants are associated with amnesia. Several benzodiazepines and zolpidem are associated with memory impairment and amnesia. The authors caution that association does not prove causality and that further research is needed to prove the medications are causing the memory disorders. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.